So over the last 24 hours, we've had about 37 cases. And right now we have 5,495 active cases across the country. This would be a significant drop from what we would have seen, let's say, about 2 weeks ago, when we were at its peak with about 13 to 14,000 cases. So we have seen a declining trend of new cases, and I guess by the end of the week, we will see this 5,495 drop further as less people are getting infected and more people are getting discharged. In addition to the cases that we have, of this 5,495 cases, we have 99 persons in our various hospitals. And of the 99, we have 69 of those persons at Ocean View, with 17 of those at Ocean View in the ICU. Over the course of the pandemic, we have had a number of pediatric cases. In total, we would have seen, since the pandemic started, to now, 7,831 pediatric cases. Most of these cases have been mild, so they don't require hospitalization, but unfortunately we've had 55 persons coming into the hospital, and of these 55 persons, we would have had 17 deaths, and that's for the entire duration of the pandemic. As of today, in terms of the adult population, we would have administered 426,317 doses, first doses that is, and that would account for 83.1% of our adult population. In terms of second dose, we have administered 317,770 doses. That's about 61.9% of the adult population. As of now, we have only been able to administer 42,629 booster shots, and this can really improve significantly. So I really want to appeal to everyone who would have gotten their doses, let's say 5 months ago, to please come back now and get the booster shot so that you can remain protected. We have also been working through a couple of mechanisms to try to get vaccines for children between 11 and 5. One such mechanism has been through CARICOM, and they have been having discussions with the folks at Pfizer to see whether or not the Caribbean region would be able to access these vaccines. We have made known how much of these vaccines we would need for our population, and we are anxiously awaiting for those negotiations to be completed for us to get an understanding of when we can access those vaccines. Well, COBICOR, we have been working with the population to get them to understand, first of all, the public health measures. This includes social distancing, wearing masks, sanitizing, and so forth, because these measures, they help to reduce transmission of the disease. So the Army and the police and other agencies have been helping us to inform the population, first of all, and then secondly, to enforce some of these rules so that people can comply with them. The thing is, though, while we would have had some measures of success, I think a lot of people have become very complacent, and their businesses, who were once very vigilant with these measures, have started relaxing them. And similarly, with various entities. If we relax these measures now, we are still going to see transmission. And therefore, this is not some people doing the right thing and others being able to violate the rules. We have to take a conscious decision that all of us are going to be involved to make sure that we can protect ourselves and the population.